So Beth, we just went through this previous segment about that first relapse and then going through with dealing with, the disease being refractory to this and that. And eventually got to the point where your doctor said, you've got triple class refractory disease, meaning that, it was refractory to the IMiDs, to the proteasome inhibitors and anti-CD38 monoclonal antibodies, which is just a lot of
Right.
jargon for other people. But you
Yeah.
obviously lived this and we're going through different treatments with different combinations. So then he says, Beth, we need to try something else. So he brings up a few options, right? And I just want to go over some of these individually. The first big one he mentioned, one of them was CAR T cell therapy.
Yes.
Um, so, of course, engineering the cells within your own body, and then it would be sent off, to do that, and then come back and be put back into your body. And that was supposed to, of course, be hopefully one solution. Can you describe that conversation that he had with you, how he described the CAR T process, which at the time wasn't approved for myeloma just yet? So maybe it was in the clinical trial setting. But how he described it, and then what your decision making process was like with CAR T.
Yeah. He did describe it as it kind of like a bone marrow transplant in a lot of ways, a lot less harsh on the body, and less extensive as far as, time in the hospital, that kind of thing. Um, and so it was something, and he said I'd have to go somewhere with a big hospital where I'd receive treatment. I have to stay there for a few months, to get the treatment throughout the whole thing. And so that was a difficult proposition to do that. My mom lived in Denver still. She's currently living here. So it's going to be even harder if I decide to do that eventually. But yeah, so I'd have to live with my mom and travel back and forth to the hospital. And so that was something to consider. Also, I had been on Blenrep, which is the same kind of, what's the word? The way that it works is kind of the same as CAR T. And so Blenrep did not work for me. And so the doctor's a little bit right now. We just had a conversation like 2 weeks ago about it. And I asked him about CAR T. I said, I'm really starting to, because if this treatment that I'm on right now, the selinexor, if it stops working, what's the next step? What do we have left? We've gone through so many things. The list is getting shorter. Although there's so many things that come out on the market constantly. So it starts to add down at the end, but it is getting shorter for me. And so CAR T is one of the things that could possibly,
You could revisit. Right?
Yes, we could look at. And so anyway, so he said that because of I didn't respond to Blenrep very well, that maybe I would not respond to it, but he's still open to it. He still wants to talk about it. We're hoping that this treatment will last for a while. Maybe he's hoping at least a year, and maybe more. I've heard of some people who are doing it for 4 years. So, so we're just hoping that we'll just go on this treatment for as long as we can, and then we'll revisit the CAR T and then whatever else is on the market at that point.
Okay, I'm glad you brought that up because this is a great, window into how you and your doctor have to think about, like you described, there's a list and it's almost like, okay, here are all the different tools we have.
Right.
So you mentioned Blenrep. So I'd like to talk about that, which is, that's I don't want to even go into the actual sort of, that's the commercial name, but it is a BCMA targeted therapy. And there is the one major toxicity that is described that has to do with the eyes. And you actually did encounter that very terrible side effect.
Yeah.
So, the medical jargon name is keratopathy, which is, it can attack the outer lining of the eye. But what it really means in terms of humans is painful dry eyes and decreased, visual acuity or ability to see, just to generalize. So I'll stop talking about it. And Beth, can you describe what the treatment was like on Blenrep in terms of, was it oral and then how often? And then when you started to feel the side effects and what they were.
Right. Oh, yes. Now I can't even hardly remember. I think it was oral. I only did it for like 3 months because I wasn't seeing a good result from it. But when I was on it, I'll tell you, the dry eye was just terrible. You just had to constantly be putting like gels and creams and drops in your eye just to try to not go crazy because it was just so painful, and it was itchy and hard to deal with. And also I'd had cataracts forming from when I was on Revlimid, and the dexamethasone also causes it. And so I was having, but it wasn't bad enough to do surgery. But when I went on the Blenrep and I was having all these problems, I couldn't see, I was having double vision. It's crazy. A nice lady from our church would come, and she'd come to my house and she would read to me. She was a former school librarian, and so she would bring books that she loved to read to her students, and she'd come and she'd read to me because I could not read. And it was so nice. What a kind thing that she did. But anyway, so but it was that bad where I could, and I'm still struggling. I had cataract surgery. It caused the cataracts to become so bad that they had to do surgery on both eyes. And now they just did some laser treatments on it to try to finish some of the cataract stuff up. And I still can't read. I was showing Stephanie, I have to use glasses on top of glasses in order to read right now. But they're still working on that, but it's all since the Blenrep. And, it's hard because, it didn't work for me, but I still had to go through all this. And I really haven't seen normally, I bet at least a year and a half, pretty
Wow.
close to 2 years.
Yeah.
So for a long time, I couldn't drive. My husband had to drive me to all my appointments. Friends had to drive me. I finally can drive now, which is great, and I appreciate that. So that makes me really happy. I can get out of my house. But
Well, because
yeah,
what you're describing is like driving, for instance, of course, is
mhm,
it's like freedom,
yeah,
autonomy. It's the ability
it
to not
is.
have to depend on someone to get somewhere.
Mhm,
And then I think you described the pain in your eyes as almost like feeling like there were rocks in your eyes or
yes,
something.
definitely.
So
Big rocks.
big rocks in your eyes. And so,
Yeah,
what helped you? Did anything help? So it was really eye drops. I mean, what in particular helped you deal with, because the point of that one is, it didn't help with the myeloma. I mean, if it had, at least it would, but what helped you deal with the side effects that the Blenrep?
I think, like I said, the eye drops and things like that, I think rest was really important. I laid with my eyes closed a lot. That seemed to help, keep them lubricated a little bit more. Um, I think, just trying to have a good attitude and saying, this is going to pass. We're just going to, get through this. I saw an eye doctor every week before chemotherapy, and they'd have to check to see if it was too bad, if the keratopathy was really bad that week. They would not treat, and they would skip a week and go and treat the next week if the eye doctor gave her approval.
Right.
So
Okay.
yeah, so that was helpful as far as them monitoring me all the time. And so I appreciated that. And the doctor and the eye doctor and the oncologist kept in constant
Right.
communication.
Communication. Yeah. And you're describing the risk evaluation and mitigation strategy program, or REMS, that is put in place, anytime someone is going on this, or that's the
Yes.
plan, right? Is to make sure
Yeah.
that there's, yeah, the eye specialist with your oncologist or, hematologist, who can always be in communication about where you're at. Can you do this?
Right.
Can you describe? I was so curious. I'd heard another oncologist actually talking about the REMS program with Blenrep. What kind of eye tests are they doing? Is it like when you go to the doctor and you're staring into the little, microscope looking thing, or?
Mhm. Yeah, every time I went, they would do all the little pre-tests, that they would do for like a normal eye exam. And then she would come in and she could look at the cornea and see, if there was too much inflammation, or if she could totally tell if there was the extent of the dryness of my eye. And so she would just look manually with, her her tools that she had. And that's really what it was. And it took maybe 10, 15 minutes each time. And she was really great. She just, it was interesting to her. She'd never had this happen to anyone, of course, before. And so she was really interested in it, and did some research. And so I really, it was great as far as that goes.
I'm glad you brought that up too. I mean, this was, when I had spoken with this other oncologist who specializes, a myeloma specialist, he said, yes, this is a side effect, but most people actually do not experience, especially that significant of the side effect with the Blenrep, with the vision. And
Mhm.
so it's a great learning to hear from you. You did experience it and how you were able to sort of manage it. Unfortunately, of course, for you, again, the important part is it didn't help with the actual myeloma. So
Right.
because it's one thing, I'm sure, if it's like, oh, this really is terrible to deal with, but
Yes,
you're
I'll do anything to help the myeloma. Yeah.
perfectly said, right? I mean, that's why you have this list and you're so open-minded about it. And so I'd love to shift now into what is working, which is great.
Sure.
And, always depends on the person. But for you, around November of last year in 2020, your doctor, your hematologist is like, okay, let's try this new combination. It's the Velcade, selinexor, and dexamethasone. As you said, Dex is always a part of it. Um,
Right.
but you had some incredible results. So first, could you describe how your doctor, characterized this combination? That selinexor is this new part of this combination, and then we'll go from there.
Yeah, and I don't know a lot of the technical things, but he just had said there's this new combination coming out. The selinexor is pretty new, and then with Velcade, um, let's just see if this works. And it wasn't even out on the market yet, and he was able to get the insurance company to approve it each separately, which was really great because I was able to start. And I was in a desperate situation. I had a tumor on my sternum that was 4 inches by 3 inches by 3 inches. And I mean, we're talking inches here. We're not talking centimeters. We're talking inches. It was clear across my chest, um, and visible. And it was just growing like crazy. It was just out of control. And my light chains, which said earlier, I'm normally around 0 or 1. And then I was up at 70. I'd never been at 70 before. And that was really scary. And I was feeling terrible. Um, most of the symptoms of myeloma that I've had are just mostly pain and maybe some fatigue as far as the symptoms of the actual cancer. But at this point, I was weak. I was, short of breath. I was having to be pushed around in wheelchairs, those kind of things. Um, just not doing well at all. And actually, we did an interview with the doctor, and he said he would never say this to me face to face, but he said, I wasn't sure what we were going to do. I didn't know what our next steps were going to be. And he's always been so up and positive with me. And he said, we have a lot of tools in our toolbox, all these things. That's the first time I'd ever heard him say something like that. And so he was really excited about this new combination because the Velcade had worked for me before, and we didn't stop it because it stopped working. We stopped it because of the neuropathy. And so they didn't want to continue to, and see if the neuropathy would reverse itself and all of that. Which it kind of did a little bit. But anyway, so he knew that the Velcade was a good fit for me. And then with the selinexor on top of it, he was just really super excited about it. And so, do you want me to talk about the results of it?
Yeah, well, so yeah, no, that's wonderful. I was curious, I know, so it's oral, but if you could sort of describe that the treatment, like the regimen, people are very curious, like how often are you taking, how many, and then of course any side effects.
Yeah. So when I first started, I started on 100 milligrams, which is the highest dose. And, but you can adjust that dose to a lot of different things. And so I started on the 100, and then 40 milligrams of Dex a week. So 20 on one day, 20 on another day. And then one shot of Velcade a week. And so I would just go in, get the shot for Velcade, and then go home and take the Dex and the selinexor. And so the side effects are pretty minimal for me. The biggest thing that I experience is my taste is different. And so food doesn't taste the same. And I don't, and it's funny because that's not listed as a side effect. And I talked to I went on a support group of selinexor patients one day, and there was a special speaker, and she said that it's not listed, but she hears it from several patients. So they may have to start listing it. But anyway, so that's one bad thing, because nothing tastes good to me at this point. I mean, even chocolate, it's not as bad as when I did VAD. When I did VAD, I couldn't even stand the taste of chocolate, but I can kind of eat it, but it just doesn't taste the same anymore. That's the biggest thing. I do experience some fatigue. I think that's a lot of the dexamethasone, where I'm on it for 2 days and I'm on this high and I'm not sleeping and I'm full of energy, and then it drops way down, and then I'm feeling, so tired, and maybe the effects of the selinexor kind of kick in more, or I feel them more. A little bit of nausea, where I've had to take, do the 1, 2, 3 medications. But really not that much. It really has made me feel so much better. I'm like a different person than I was, say, 6, 8 months ago. So, and I'll just say that, I mean, the first week that I took it, the tumor on my sternum just went down by half. And then my light chains dropped from 70 to 25. And then the second week, you couldn't even tell I had a tumor. It was completely gone. My light chains were down to 0. Well, a little over, like 0.1 or something like that. And so it's just made a huge difference for me. And we're just hoping that it continues. We've had to adjust the dose because of my platelets. It really affects my platelets. And so, especially because I've just had a crazy few months where I've had 2 cataract surgeries. I had to have my port replaced. And so when you do surgeries, you got to make sure your platelets aren't too low so you don't bleed too much. And so, so I've had to skip some treatments because of those things. I've had to, they've gone down to 60 milligrams right now because my platelets are so low all the time. They won't recover like they want them to. Some of my other numbers are pretty low, but they're kind of borderline. So they're just kind of, so sometimes I'll do 80, sometimes I'll do 60. I haven't been up to 100 for a while. I think if my light chains start going up, they have gone up a little bit from 0 to 3, but they're staying steady at 3, which is great, and I'll take it. But I think if those start to go up again, they'll probably increase the dose and try it at 100 again.
They're going to play around with that depending on what your numbers are.
Yeah.
I'm so happy to hear about how successful, this has been, especially after going through so many other combinations that just weren't working. Yeah, your doctor had described it, I think, as a 90% drop in the light chains within 2 weeks, which is incredible. You did mention something about the 1, 2, 3 medications. Can you talk a little bit more about that for people who are unfamiliar what that means?
Yeah. So, can I say what the drugs are? Okay. So, the first drug is Zofran, and oh man, I'll tell you what, when I was first diagnosed, Zofran was like $20 a pill. It was so expensive. And now it's not expensive at all. And so that's the first line of treatment for nausea. And so you take that if you're not feeling any better from that, and that usually does the trick for most people. Then you take compazine, which is prochlorperazine. That's the other name for it. But that one, boy, I'll tell you what, it does it for me every time. I just love that drug because it does it for me every time. If the Zofran doesn't help, boy, if I take compazine, then I'm feeling so much better. And then the last one is Ativan, or lorazepam. And that one is for anxiety mostly, but it does help with nausea and it helps calm you down. And so that's like the third line. So if you're really still feeling sick and nauseous, the last one is Ativan, which a lot of cancer patients are on anyway and take anyway for anxiety and different things. And it helps kind of counteract some of the dexamethasone side effects as well. So anyway, but yeah, so that's the 1, 2, 3, and it's wonderful.
Thank you for describing that. I think that's going to be so helpful for so many people, especially
Mhm.
to ask their medical teams for it if they're
Yeah,
not being offered, right?
for
So
sure.
if you are feeling it, don't be afraid to ask for things that you want to try.
Mhm.
And as we know with nausea, that kind of side effect, it's always good not to chase it, right? It's good to get out ahead of it,
Exactly,
right?
for
Because
sure.
once you get that feeling, I know through my chemo was different, but when I was feeling nausea, it was like, as soon as I start feeling it, it's so much harder to get over. So I would just
Yes.
be taking the medications beforehand. Thank you, Beth. I'm curious about, what this means for you. I know that you're constantly wanting with your doctor to have other things on the list just because of the nature of the disease. And I know you are open to trying so many different treatments and combinations, different therapies as they come. But right now, what's working is the selinexor combination, and it's been working for some months now, half a year, or
Mhm.
longer. Actually, it's been working for longer. And I wanted to understand what that means to you in terms of, okay, that clinical trial worked and it was approved. And now I can use it. And it physically, the tumor shrank, the light chain numbers dropped by 90%. But what was the impact for you and the quality of life for you and the day to day for you?
Yeah, when I was going through right before the selinexor and things weren't working and we're trying all different kinds of things and the doctor was feeling um, like he was not sure what we are going to do next. And I was feeling so bad physically. Um, I was it was also really hard emotionally because I kept thinking, we're down to the bottom of the list. There's nothing else left. I'm going to have to do CAR T, which, is fine, but it wasn't what I wanted to do at that point. Um, all these things. And I felt like, when I started, or I would cry a lot, everything would make me cry. And that's just not my personality. And they were giving me medications to try and help with, like some depression issues, so I wouldn't cry about every single thing. Um, and so that helped while I was going through that. And then when we started the selinexor, it was like a new beginning to my life in a lot of ways because I'd been really suffering really for over a year and not knowing what was going to happen and things were. And I'm pretty an upbeat person, I don't think about the hard, like I don't get caught up in the hard stuff too much. But this was just one of those times where I really did. And, um, you know, it was feeling like, I read the stories about the people with myeloma and people my age that are, who are dying because they're just not responding to treatment. And so that's where my mindset was really going. And, this is going to be the end. This is, we're not, I also had a friend with breast cancer who was dying at the same time. And so we were kind of going through it together and it was really hard. And she actually passed away while during all of that. And so that just made it, hard too, because I thought, oh, this is where I'm at. I'm going to follow this same path. And so it's been kind of surprising the way that the selinexor has worked. I kind of wasn't expecting it. And so it's been great. And I just feel great. And I'm just hoping that it just keeps going.